we have a panelist on our Ibogaine and International Practitioners panel who has to leave very, very soon. So if it's all right with you, and especially if it's all right with you, Dr. Saruya, what we'd like to do is to move the Ibogaine session on the clinical side up a little bit. And then Dr. Saruya, you would follow right after Dr. Hinson's address. Awesome. Okay, great. In that case, I'll turn the time over to Kim Adams, who is moderating our panel of international Ibogaine practitioners.
And we have some folks calling in, so we'll wait for them to pop on the screen here. Welcome to the panel on how Ibogaine and Iboga are actually being used in real time in other countries. So we've got some incredible panelists. Yay! So these wonderful humans are calling in from Brazil, Mexico, Canada, and we were going to have Martin Polanco, but unfortunately he wasn't able to make it. So Zach Skiles is here on behalf of Mission Within. So thank you so much for being here. And welcome, everybody. Give us a little hey so we can make sure we can hear you.
Hey!
All right, fantastic.
Hi.
So my name is Kimberly Adams. I'm the founder of Lit Marketing, and I use my powers for good in the psychedelic space. I've also been the founder of Decrim Nature, one of the founders of Decrim Nature, which was the legislation that was in Oakland, California that got put in lots of different cities, and I've also worked on other legislation. But the reason why I wanted some of these incredible humans to talk to us today is because if we're going to move legislation forward, we need to hear from experience. And this panel represents 65 years of actual hands-on experience of serving these medicines. So it's incredibly important, and I feel like it's just an honor to have this wisdom here with us. So I want to welcome you guys in order of how I see you. So Patrick and Michelle Fishley, they are near and dear to my heart because they've served me Iboga 7 times. They've held my puke bucket. But Patrick Fishley is an RN, a BSCN, and a CCRN in Canada. He still holds his license there. And Michelle Fishley is an LPN, but she is retired and serves Iboga in the Bwiti tradition. Both of them go back to Gabon every year and learn directly from the source. So they're an incredible resource. And then Dr. Carlos Alver or Alvier? I always say it wrong. Oh, we don't hear you.
Alvear.
Alver Lopez is calling in from Mexico. He is the medical director at Inscape Recovery. I've known them and worked with them for about 5 years. They're in Ibogaine aftercare. So they work with people after they've experienced the medicine, understanding the nature of what happens psychologically, physiologically, and spiritually after moving through these spaces. And then Dr. Bruno Rasmussen, I know that I say their names wrong, so I just want to make sure I'm saying it correctly, is calling in from Brazil. He is the clinical or the medical director at the Veracruz, Brazil Institute. And he has 30 years of serving this medicine in a public hospital in Sao Paulo. So really incredible. Patrick and Michelle, if you can share a little bit about how many people you have served and for how many years?
Wow. Well, I know for certain we've been serving for 13 years. The amount of people, wow. Hundreds and hundreds and hundreds of people, thousands of ceremonies. And over the years, yeah. In Canada, in the States, Costa Rica, other places as well.
Fantastic. And Dr. Carlos, I know that you don't actually serve the medicine there, but you serve boosters if that is appropriate. But how many people have you seen in aftercare and for how many years?
So we've been working for 14 years now, and we've seen around maybe from 800 to 1,000 people along those years.
And Dr. Bruno, 30 years. Have you lost count or?
No, no. Yes, 30 years and around 2,500 patients. No, the truth is 205,000 treatments because some patients took Ibogaine more than once. So 2,500 treatments I helped with.
Amazing, amazing. And do I call you Dr. Stiles because you're a PsyD? Yes? Okay. On behalf of Mission Within, can you give us a sense of how long Mission Within's been working with clients?
Since 2017, we've had our doors open. I came in 2019, and we've served just around 1,500 individuals.
Fantastic. Awesome. Wonderful. And you want to share a little bit about what you do there just so that folks understand?
Yeah, so I'm Director of Services at the Mission Within. I'm helping out coaching services right now as well as retreat services. Outlaying standard practices and kind of best practices for our coaches who are all mental health professionals.
Fantastic. Thank you. And let's just dive in because we're already behind, but we want to really pack this panel. So I want to say that I had a chance to sit down with Patrick and Michelle before this, and we did a remote interview on dosing, styles of dosing, as well as some definitions of the different kinds of medicine that you'll see. You'll see Ibogaine, Iboga, TA, total alkaloids. There's also synthetics that Dr. Sames shared with us. But can we go around and share a little bit about what you guys specifically serve and how you dose? Because there's many different ways, and like I said, that interview really dives deep. It's about a 30-minute, 40-minute interview to really describe those different styles of dosing. But just for people to be aware, from a traditional side, Patrick and Michelle, how do the Bwiti serve? How do you serve? What is the style in which you serve?
Okay. We use the whole plant in the form of root bark. We start with that. We can also use the total alkaloids. So it's just the wood has been stripped away from the medicine itself. So it's a little more concentrate. And we use that in a capsule form, which can be a little easier on the stomach as well. Mm-hmm. When we're dosing, we titrate to effect. So we don't basically just go on milligram per kilogram because, let's face it, everybody is different. Everybody biotransforms things differently, and it's really about going to seeing how they're doing. So we stagger our doses and see where everyone's at and keep moving forward until we reach that window of total effectiveness.
Mm-hmm. And in Gabon, they use the total alkaloids, so they use the whole plant, and they'll make a tea. They'll shave to get the what they normally take. It's the inner bark of the root, and then they'll take that root that they've shaved, put it in a pot, boil it, and make a tea out of it. And those are the two ways they usually use the plant. They also mix it with honey and other plants sometimes to help with different things depending on why the person's coming.
And how long do people usually stay with you? How many days do you tend to do the flood dosing of the Iboga?
So usually we have people for 8 days, including arrival and departure. They do 2 flood doses with us usually.
Dr. Bruno, how about you? What do you serve, and how long do folks spend time with you, and a little bit about the way in which you serve?
Yes, well, people stay with me for 3 days, but at the hospital for 24 hours. And I use Ibogaine HCl from Huacanga, Africana. I have a little experience with the A and root bark, but when we do it in a hospital, we have some restrictions. So that's why in this situation, it's mandatory for us to use HCl. And it depends on the problem that we are treating. Like if we're treating depression, we can use lower doses. If we're treating addiction, we must use higher doses. And here in Brazil, we have a big problem with cocaine and crack cocaine. So most of our patients are from cocaine and crack cocaine. So for them, we use 15 milligram per kilogram. For patients using opiates, we use a little more, like 17 or 18 milligram per kilogram. And for depression, we use around 8 to 10 milligrams. And we differentiate between women and men. So for women, we use a little lower doses, and for men, a little higher doses. But it all depends on the moment and on the patient. Normally, we have this feeling, as Michelle and Patrick said, exactly that. We have this, we really try to use the dose that the patient needs. So we start slowly and escalate the dose during time.
Thank you. And what is the typical way that you guys dose, and as well as what you use?
It's similar to what Bruno was just saying. So we start off with about 14 milligrams per kilogram, but it is case by case basis, depending on a person's substance use history, mood disorders, anything that's pretty prevalent that may need to be addressed. The ritual itself, we have our medical leads actually a curandero as well, or a curandera. And so we have kind of a ritual that we'll do with each cohort that moves through on top of addressing medical needs.
Amazing. And you guys also offer 5-MeO DMT.
Right, that's the regimen. So it's a 4-day retreat that's been built out now into 5 days for our regimen of Ibogaine and 5-MeO. So you'll have Ibogaine on, let's say, a Friday night, have the gray day on Saturday, and Sunday morning you'll have 5-MeO DMT.
Fantastic. Awesome. Yeah. I know that you guys are well known for your work with veterans. Is that typically who you serve primarily, or is there other people that you will serve?
Really, anyone who can walk through the door.
Okay.
We concentrate on veterans, thankfully. I'm a veteran myself, so I'm partial to that crowd. But more recently, American football athletes and first responders, yeah, mental health care workers as well.
And Patrick and Michelle, who do you tend to see? Because I know if you guys have seen the documentary Dose, Patrick was in that, and that focused specifically on addiction, heroin addiction, and other addictions. But I know in recent years you've definitely broadened that. Who do you typically see, and who are you moving towards seeing in your client population?
Really, it's anybody who has addictions to the mind. That's where it all starts from, and that's where everything starts from. And so we have people coming who are seeking more clarity, going deeper to who they are. We have people who are battling depression, anxiety, trauma, PTSD, CPTSD, etc., brain injuries. We have a variety of different veterans coming our way as well, first responders, just anybody who has the dis-ease of the mind.
And I know, Dr. Carlos, you see people much broader than that, because you are not just working with people post-Ibogaine, but also serve other medicines. Can you share a little bit about what it looks like in your aftercare program in terms of who you're seeing, how long they're there, what else do they interact with, what substances do they interact with?
Yeah. So basically, if we're receiving them after Iboga or Ibogaine, then and they're coming from addiction, they'll stay in between 4 to 6 weeks in our program. And we're developed a strategy where we address the psychoemotional realm, the medical realm, what we call the somatic realm. We do the plant medicine realm, which is we use other plant medicines after the 12 to 13 day experience of the Ibogaine to stabilize the neuronal receptors. And then we do also the expression of creativity as a means of the participant. We don't call them patients, we call them participants, to engage in their capacity to create self-expression and be creative. And these 5 areas are what we've developed along these 15 years that we see that can support the capacity of bringing the individual back to the self, and in that reestablishing that axis of self and ego and action in service.
Yeah, and they're with you between a month and 6 weeks?
Yeah.
Yeah.
Correct.
Yeah, and Dr. Bruno, you mentioned that you're in Brazil. There's a lot of cocaine and crack cocaine use. That's primarily who you're working with in the public hospital?
Exactly. Most of the patients that we treat are cocaine or crack cocaine users. And sometimes we treat opiate users, but interestingly, the opiate users, they normally come from America. They are not Brazilians. So we can see, and we can see the difference in the last years of a lot more people coming down. So, but normally our patients are cocaine and crack cocaine patients.
So I just want to just make a statement because I spoke with everyone beforehand. With these years of serving, none of them have had a single death under their care. I just want to make that very clear. And I know Dr. Sames had an incredible presentation of talking about the cardiotoxicity as well as many of the other elements. But the medicines themselves, and I'm speaking, as a non-medical professional, but someone who sat with the medicine and knows a lot about this, the medicine is not dangerous. It's what people who are serving it and not understanding how to serve it. It is incredibly important to listen to the words of wisdom of people who have been there. So in that vein, can you guys share a little bit about how you learned how to serve these medicines and how we can help others to understand how to serve these medicines safely and effectively? Who would like to start? You want to start there?
I think I would just say starting low and slow is the ultimate wisdom, that somehow getting to a certain point in an accelerated pace is always what our society wants. Let's get there and let's get there fast. But speed is an urgency, and urgency is a trap. And finding a path that is authentic to another person's healing actually needs to happen slowly. And so the best way to do that is by administering in a same kind of vein. For us, at least, that's kind of been our motto.
Yeah. There is a style called slow and low for those that don't know, and you can find a little bit more, but that is dosing over weeks, very small amounts, but there's also just, you can't take it back, So Dr. Bruno, as you have worked with people, how did you begin? I mean, you can expand this a little bit. How did Brazil allow for this to happen, to be able to serve in your country?
Exactly. Well, I learned a little or a lot with Howard Lotsoff and Norma Lotsoff, and I learned a lot with Claire Wilkins too. And well, Brazil is a special situation. I will talk about the regulations in Brazil, I think, next. But it's a special situation because Ibogaine is not scheduled here. We don't know what happened, but it seems that probably someone forgot to schedule it here. But the fact is that it's not scheduled, okay. It's not controlled. And this gives us a space to work, as I do in a public hospital. But now we know that the government is aware of what's happening and supports what's happening. It's a good thing because they are open to idea of having Ibogaine to treat the crack cocaine patients. So, but I agree that the worst enemy for Ibogaine providers is the hurry. Patients sometimes look Ibogaine treatment like a drive-through. They want to arrive to take it very quickly and go back. So it's not the way to do it. It's like any other medical procedure, have its risks, but not as dangerous as people think if you do it the right way. But if you do it the wrong way, anything is risky. Even going to the dentist, taking anesthesia, it can be problematic. So if you do it the right way, and if you compensate the patient the right way, so the patient must be, it's interesting, and maybe strange to say this, but the patient must be in a good state. Even if he's struggling with addiction, he must be the most possible compensated. So Ibogaine must go into the system in a person that is almost fine. only with the drug problem or only with the depression problem, but not other problems like kidney problems or liver problems or cardiac problems. So if you look it with a medical eye, it's safe. That's why all of us never saw that, and hopefully will not, because we take care. We really pay attention to this. We do tests before. We really we are careful. So that explains the not, for it not to be so dangerous with us, because as you said, the problem is not the medicine. The problem is, from time to time, it appears people that don't understand the medicine and compare it with other substances. So as like psilocybin is not so problematic, people say that Ibogaine is the same thing. So if you took a little more, it will be okay. No. The therapeutic dose and the problematic dose, they are close. So we must pay attention. I always say this. I remember when I was a student a long time ago, there was a medicine to treat blastomycosis, is internal, a pulmonary mycosis that we have here in Brazil a lot. And this medicine was so strong that it was mandatory for a resident to stay sat beside the patient for 1 hour until the medicine runs into the veins and goes away. So Ibogaine is almost the same thing. You must be around, you must be always checking everything, and it goes fine. It goes fine, and it's super helpful. And the reason that there's a lot of people working with this is that it's so satisfying in a way that you really feel that you were a part of the help. What does the work is Ibogaine, we know, but as we facilitate, Ibogaine is super satisfying to be a part of this.
Love it. And Patrick and Michelle, you have a particular way, because you dose to effect, or there's an understanding. Can you share, we're in a school of medicine here at UPenn, those that, when you're looking at a client, what are you seeing physiologically, psychologically? How do you assess their state? Because I think, for better or for worse, psychology is a soft science, and we have to interact with the human to find what's going on. But these lines are blurred, because we're working very much in the medical space, because you have to be aware of the physiological. So what are you looking for? How can you assess that space?
Oh, well, like it was said earlier, every experience is so personal. And so I think one of the things is knowing who you're giving medicine to, and knowing that person to some degree. And then also, there's some ways the medicine comes on that's pretty typical. People start to, maybe they get a little restless in their chair. They might start feeling a little sleepy. They start feeling like tingling in their hands, their feet. So there's kind of these like subtle signs that the medicine is coming on. And then talking to the person a lot, talking to if they're seeing things. And I like to point out here very clearly that maybe 50% of the time Iboga is visual. It's not always visual. It doesn't always work in that way. And people get really stuck on visions, and they think they need visions to have a profound experience, but that's not always true. So noticing, like, what are they seeing? How are they feeling? Sometimes people just say, I feel totally calm. Like I've just, like an abnormal calm, like in a way they've never felt before. Or they feel like they're in deep, deep meditation. And so their mind, they can't actually hold a thought. They can't, like, keep thoughts. Like, a thought will come in and disappear immediately. And so these are signs, of course, that the medicine is starting to affect the mind. And then, of course, we get them to stand up. Sometimes we have to just actually get them to change their position, sit up in the bed and look around, take their mask off. How do they feel? Is there ataxia setting in? Those sorts of things. So there's lots of signs that show the medicine is working, but I think it's experience and knowing what those signs are.
So, if let's say you're an egg, okay, and say you're given a lot of medicine, kind of crack you open and see what's going on. So what happens when we crack the egg? It has all these different splinters, little shell fragments, everything, and it's a real mess to get off and take away, and to work through. But if you peel it slowly and intentionally, with care, you get to see exactly how everything is moving, how things are unfolding, where the egg is through the whole thing. And so, like with our clients who come, we're watching, we're assessing the whole way. We never stop assessing for the 8 days you're here, right until you leave. We assess, we watch. Is this different than it was yesterday, or was an hour ago, or in which way? How are they moving? Because there is ebbs and flows throughout this process. There's highs and there's a little bit of lows, because we're moving through the human experience. We're trying to make sense of who we are. We're really reading the book of you when we're going through it. So we dose in that manner, and we watch constantly to see what is happening for the desired effects.
Thank you. And Dr. Carlos, since you're seeing people after the fact, and I will have several follow-up interviews also with Martine, since he wasn't able to be here, to go into how these phases look typically in clients. But afterward, you're seeing people in a space, sometimes in the most calm space they've ever been, or potentially in some of the most confusing spaces, because I can say, as I came to the medicine with PTSD, I suddenly was calm and it freaked me out. And people who are removed the desire for a substance, that's something that's been their friend for a very long time. So how do you feel like you can navigate with people in that space? I mean, I know you have some wonderful tools, but when you're speaking with someone after this experience, what's the primary focus to support them through that?
For us is to bring them back to their body awareness. The body is their best resource, and to reestablish habits, proper eating habits, proper movement habits, proper sleeping habits, and through these phases also help to reestablish a narrative to their current life experience, because in most cases addiction has shifted a narrative of shame and guilt. That's part of the huge aftermath of addiction, and you can have the right neurological or neurophysiological shift, but if the narrative is not changing at the same time, then you'll be stuck in the way that you're perceiving yourself and you're perceiving the other. So a lot of work shifting narrative, and a lot of work creating compassion towards yourself and shifting the way you're going to relate to the other, because your relative, your partner, your family did not go through Iboga or Ibogaine. And this means that you need to understand that your process is possibly in a different wavelength than the one of the person that you're going back home to. And so what is that support afterwards, and how do we establish those levels of clear connection and clear communication, and work through the codependent dynamics that establish a pathological relationship? So it's much more complex than just the substance. No, I think the social fabric needs to also be addressed, and that's what we do in this 4 to 6 week program. So we not only address the patient, but also the family members, if they are willing to.
Thank you. And Zach, you obviously are seeing people from the United States in Mexico. And to bring this conversation a little broader, how do you think that we can support changing the perceptions of what it is that we're doing? Because we are bringing military primarily, and you guys are seeing a lot of military. that's a stark contrast to, you know, the crunchy groovy beliefs behind what psychedelics once were. How do you help support the families when they return, and really, in a broader sense, how can we change some of these ideas about these processes that you guys are so incredibly good at?
It's a great question. So there's multiple points that we use. So we'll use something called integrative group dynamics in our integration process with folks. And also we've established a family and community weekly group for people to show up and kind of learn, okay, what's the psychological container we're using through their process? What's the spiritual lens that we're using? So meaning making. And then offering little coaching sessions around what is going to help foster integration in the practical sense, not just prolong our emotional bypassing, but what are we doing to pay our bills and connect with each other? And so from the integration, we're replacing words like no with yes and. Even if I don't want to do it, yes, and I'm gonna try something else right now. There's little techniques here and there that have actually been really beneficial for folks. When it comes to the greater political kind of push, is for a lot of people, you just have to be the change. There's no other way for a lot of people who come to us from like middle America, and I see the look in their eye of like, I'm gonna have to go back there, and I don't know how I'm gonna describe this. And many people really have to attend to kind of the normalcy of folks who have been through the experience, those social bonds that they have with us and other folks who have been through our colleagues' programs.
Yeah, I have like 17 more questions, but unfortunately we have to go. But I want to say that I will be interviewing everybody separately, and they'll be recorded and then linked to the in the description of this recording, so that those at home and everybody here, you'll get to hear more from these incredibly wise voices. And if there's anything else you want to leave us with, just to share, I just want to say everyone has experienced the medicine that they serve. Just say a wink, maybe try it. But anything else that you guys want to share as a closing remark?
Well, I'd like to say thank you for inviting us. It feels really special to be a part of this group of amazing minds. And I think this is just the beginning of what these medicines can offer us. I think once we can get them out of the illegal and stigmatized zone and really start like working with them and adding the other supports that we know work, like what Dr. Carlos is doing, it'll be even better. Like there's like potential, exponential potential that we are really looking forward to seeing.
And just remember to take it slow. Take it step by step. There's no rush. There's no quick fix. Life is a journey. You know, your life is a journey, and that's what we study. So just take it slow.
Yeah, and don't buy it off Instagram,
No.
generally speaking. Anything else?
A motto for life.
Thank you, Kim. Thank you.
Thank you for making time. Dr. Bruno, thank you. Is there anything else you want to say, Dr. Bruno?
Thank you. Yes, no, just say thank you for being a part of this. I'm honored. And say, yes, Ibogaine helps and facilitates psychotherapy a lot. So it's very important to remember this. It's not a magical fix, and works like Dr. Carlos are super important, because if you only take Ibogaine and come back to your day-by-day routine, it's not so effective. So it's not like as MDMA that you do the psychotherapy under the effect of the substance, but it's important to have some time to digest it, let's say. And so it's very important to know this and to do the proper way. So thank you.
Thank you so much, everybody. And members of the press, if you want to get in touch with him, I have cards. I'll be happy to connect you to them, and also others. If you just want to reach out and you want to speak with them, I'm happy to connect you. So since they're not in the room. Thank you so much, everybody. But that's here. Thank you.
Thank you.